Okay, let's go. So as I said a minute ago, the learning objectives for Module 1 are the different ways to get Medicare benefits, eligibility and coverage under Parts A and B, original Medicare premiums, help for beneficiaries with limited income, and original Medicare in Part D. So for the basics, for those who don't know, Medicare is a federal health insurance program for those who are 65 and older and those younger who are disabled. Medicare eligibility does not consider income for eligibility. Remember, that is Medicaid. Premiums can be higher based on income or lower for low income who are eligible for additional assistance. So we all know that, and I actually have it built into our training this week, we'll see the different premiums for the different income levels. Individuals can receive their Medicare medical coverage directly from the government, which is original Medicare fee-for-service, or through a private health plan. Part D is only available through a private health plan. And I'm happy to send the slide deck to anybody who wants it. Just go in the chat and put your email in, because I'll use the chat to grab the emails. So Part A is hospital. It covers inpatient care, skilled nursing, rehab, and hospice. We know that the skilled nursing that they're talking about is more not the skilled nursing that you go to live in, but it's the skilled nursing that you go to rehabilitate yourself after a hospital stay. Generally 3+ longer days, they want you to go to rehab. A lot of broken hips and heart patients get to go to skilled nursing for that. Part B is medical. It covers a range of outpatient services such as physician care, some drugs administered by healthcare professionals such as vaccines and IV medications. Chemotherapy is also a Part B, as in boy, drug. And we all know Medicare Part C is Medicare Advantage. Cover Part A except hospice, paid for by original Medicare, and that is important to know on this test, and other Part B benefits. Part D is prescription drugs, and the lesser known Part E is Medicare law regulates miscellaneous programs, Medicare cost plans only offered in a few states, mostly found in rural areas. I don't know about you all, but I have never sold a cost plan. Medicare supplements, PACE, which is the program for elderly and all-inclusive care. The different ways to get Medicare. Original Medicare A and B can be combined with a Medicare supplement or a PDP. MA plans with Part C with or without Part D benefits. Prescription drug plans, cost plans, PACE, Medicare, and Medicaid plans, known as dual eligible. So different ways to get Medicare, brief overview. This just goes over the different parts of how you can get it for those who don't know. And again, I can send this to you. This is snipped right out of the AHIP program. These types of plans are generally limited to certain geographical areas and not available everywhere. These plans can be, if I can slow down my talking, can combine with coverage under a PDP. So this just lets you know the different things. So you'll get that in your email. So Medicare began as a fee-for-service program. Beneficiaries could receive health care benefits from any Medicare provider paid directly by the federal government. Medicare evolved, giving the beneficiary an option to receive benefits and care through managed care plans. That would be mainly known as Part C. In 2006, Medicare began providing coverage for prescription drugs only through private health plans. We've already been over that Part A is inpatient, hospital, skilled nursing, hospice, and home health, and you're automatically enrolled. If not, then if you don't get it 3 months or the beneficiary doesn't get 3 months before their 65th birthday, they need to call in case for some reason they did not get automatically enrolled. Part B is outpatient and professional services such as those provided by a doctor or non-physician professional, lab services, DME, preventative, and other outpatient medical services. Under original Medicare, beneficiaries can receive covered services from any physician or facility that accepts Medicare anywhere in the United States. No referrals are required under original Medicare. And then it goes over eligibility again. And guys, I go through and just make notes off of each page in AHIP. So when it repeats, it's AHIP's fault, not my own. Age 60 for eligibility, age 65 or older, and those younger with specific disabilities. All who get Social Security income or certain disability benefits from the Railroad Board for 24 months are automatically enrolled in Parts A and B the month after the 24 months of disability. However, they may refuse Part B. So if they don't want Part B and they're on Social Security, they can refuse it, because I don't know why they would refuse it, but they can. Those with ALS receive Part A and B automatically the month their Social Security benefits begin. End-stage renal disease generally lose eligibility. This one is on the test. ESRD, end-stage renal disease, generally lose eligibility 36 months after the month in which they receive a kidney transplant. But, this is also another question, but may remain in Medicare B only but solely for coverage for the immunosuppressive drugs if they do not have other healthcare coverage that would cover the drugs. So I found that to be a little bit new information. I don't know if it's new necessarily, but it's never been pointed out in AHIP like this. And I thought it was pretty informative to say that month 37 you're going to lose coverage, but you can keep Part B so you can continue those immunosuppressive drugs. You must be a U.S. citizen or lawfully admitted with permanent residence and have been residing in the U.S. for 5 continuous years before the month they apply for Medicare. The question isn't worded exactly like that, but what you do need to know is that if you must be a U.S. citizen or lawfully admitted 5 continuous years. That will get you through the question. Parts A and B again. Others will have to sign up for A and B if they wish to be enrolled. Those close to 65 but are not getting benefits from Social Security or the Railroad Retirement Board may sign up during the initial enrollment period 3 months before their 65th birthday and ends 3 months after. Those with ESRD can sign up at any time. That is on the test. At any time. Medicare coverage begins on the 4th month of dialysis. This is an important question to know, not only for module exam, and I know they changed those, but also for the final. Earlier if certain conditions are met, but what you need to know is they can sign up at any time, and it begins the 4th month of dialysis. Beneficiaries eligible for premium-free Part A can sign up any time after they turn 65. Their Part A coverage goes back 6 months from when they signed up, but not before their 65th birthday. So really where I think that would take place is if somebody retired after they were 65 and then wanted to go back the 6 months. If they have not signed up before they apply for Social Security, they will automatically be signed up with a retroactive date of up to 6 months. Individuals who do not enroll in Part B, A, if they have to buy it, when first eligible, can enroll during the general enrollment period, which is January 1st through March 31st. There was not a question on the test, but I do get that question a lot. So if you needed to know that, there it is. Coverage begins the first day of the month following the enrollment. Those with group coverage through their employer or spouse's employment may enroll in Part A and or B anytime while covered during a special enrollment period during the 8 months immediately following the last month of group coverage. The key to this question on the test is that you need to remember this part, 8 months. So that's their window. Part A and B SEPs allow individuals to enroll after their initial enrollment period for various reasons that would enable a SEP. They listed a ton out for those of us who've been in this business, and we know them. But if you haven't been, it's going to be change of life type situations, moving to a new county or zip code. It could be release of incarceration, chronic special needs plans. If they develop a chronic condition, and there's a chronic plan available in the area for that condition, that's an SEP, weather related. There are so many SEPs. There's too many to list. We're just not even going to worry about listing them all out. If you have questions, I'm happy to go over SEPs with you, special election periods. Part A, entitlement, and Part B, enrollment. Individuals are entitled to Part A if they are eligible for premium-free Part A or enrolled in Part A and continues to pay for or premium paid on their behalf. So basically, if you have to pay for Part A, either an employer can pay that premium for you, somebody else can, or you have to, or you'll lose it. Individuals are enrolled in Part B and remain enrolled as long as the premium's paid or paid for on their behalf. So pay your premiums. Part A for the majority is free. C, you must have Parts A and B and reside within the service area. That is a question on the test. Part D, entitled to Part A and or enrolled in Part B. That is also on the test. They word it to get you to say that you have to be entitled to Part A and or enrolled in Part B. So that's just the whole sentence you need to know. Cost plans. Entitled to Part A and or enrolled in Part B. If they do not have Part A coverage, they will not have those benefits under the cost plan and reside within the service area. So what they're saying is you can have A or B or both, but if you don't have Part A, you will not have those benefits under the cost plan, which is hospitalization, if we remember from the beginning. Medicare and Medicaid plans must be eligible for both Medicare and Medicaid, meet state-specific eligibility requirements, and reside in the plan service area. Where they try to get you on the test with Medicare Medicaid is the question is actually worded about Medicare, and one of the answers is you have to meet certain income, be below a certain income. So what they're trying to get you to say is that that's the wrong answer. So make sure you read the questions right, because select the answer that is not correct in that question. So just be mindful of that if you get that question. PACE plans, 55 and older, certified as eligible for nursing home care by their state, ability to live safely in a community setting, time of enrollment. That question is on the test about PACE. Reside in the service area and meet any additional program-specific eligibility conditions under the PACE program agreement. So 55 and older, and ability to live safely in a community setting, PACE. Most are eligible for premium-free Part A, and I do like this one. Oh no, it changed. Individuals 65 or older, premium-free. They or their spouse must have worked and paid Medicare taxes for 10 years, or all eligible individuals due to a disability, ESRD, or ALS. For those who have to pay Part A, the premium for 2024 is $505. Those who or their spouses paid Medicare taxes less than 30 quarters. $278 for 30 to 39 quarters. Those are the new premiums for 2025. Those who do not enroll in Part A when first eligible may pay a penalty up to 10% unless they have a special election period. They will pay the higher premium for twice the number of years they could have had Part A but did not. That's gone up
quite a bit, hasn't it?
No, you're probably thinking the 1% for Part 2.
Okay. Gotcha.
Yeah.
Okay.
Yeah.
Thank you.
You're welcome. Beneficiaries enrolled in Part B must pay a premium. In 2024, the standard premium is going to be $174.70. Most pay the standard premium. Some pay more based on income, as reported 2 years prior. I get that question a lot from agents and clients. How far back do they go? Especially the last time I talked to a client about this, they were working past 65 and then got offered a severance. And so they were wondering how that severance was going to affect their Social Security and their Medicare. So they go back 2 years. As you can see, if you're an individual and you make less than $103,000 a year, married to $106,000, the premium is $174.70. If you are an individual, you make between $103 and $129, or married, $206 to $258, it's $244, and it goes up from there. So those are the new premiums. And again, if you want a copy of the slide deck with this information, it's also in your AHIP test. I'm happy to send it to you. Part B premiums may be deducted through Social Security checks, Railroad Retirement Board checks, or Office of Personnel Management checks. That is on the test. Receive a bill every 3 months from Medicare. Employers may pay monthly Part B premiums on behalf of their retirees. So the way the question is worded is it's going to say that there is a gentleman, same question from last year, but we do have new people on here. It's going to say that he has a small bank account and would like to use up his small savings account to pay for his Part B premiums. Can he do that? And the answer to that question is always, and always has been, is that it should be the same mechanism throughout the whole year. Those who do not enroll in Part B when first eligible, premium increases 10% for each full 12-month period that they could have had enrolled but did not. This is known as an LEP, late enrollment penalty. The exceptions are those who have group coverage through current employer or spouse's employment are not subject to penalty if they enroll in Part B while covered or during their 8-month SEP after leaving group coverage. And then I copied this and just pasted it in here, but exception from penalty. Individuals who have group health coverage based on their current employment or the employment of a spouse are not subject to the premium increase penalty if they enroll in Part B anytime while covered under the group health plan or during the 8-month period. Immediately following the last month they have had group coverage. So that 8 months begins that last month that they are leaving that coverage. In addition, individuals enrolling during any other SEP are not subject to the penalty. But the part and the reason I did that is because we all think 8 months, but we don't think the last month that they have group coverage starts the 8-month clock. Low-income subsidy, known as LIS. Beneficiaries can have help to pay for their Medicare Part A, if any. If they have LIS, they're probably, unless they didn't work enough quarters, probably are not going to have a Part A premium. Part B premium, A and B deductibles, and cost shares and or Part D prescription drug costs. There's different tiers for LIS, and depending what tier you fall in due to your income, depends how much coverage you can get through LIS. Beneficiaries may qualify for following by applying through their state Medicaid office, which is the Medicare Savings Program, which is Qualified Medicare Beneficiary Program is one type of Medicare Savings Program. Those who qualify and are on a Medicare Advantage plan also get help with their cost shares, word for word. Part D, Low Income Subsidy, also known as Extra Help, helps pay for prescription coverage. Those interested in Part D help may call Social Security Administration or apply online. Extra Help is not available in Puerto Rico, U.S. Virgin Islands, Guam, or Northern Mariana Islands, or American Samoa. So the way this question reads in the test is the answer is going to be that they may contact their, they need to call their Social Security Administration. So that's the answer. Those who do not qualify for extra help may qualify for help through a state's pharmaceutical assistance program. You need to know that as well. Medicaid is help with healthcare costs not covered by Medicare, such as custodial long-term care. The reason that bullet is in there is because if they have Medicaid, it may help with their long-term care needs. Beneficiaries with limited income and resources are encouraged to apply to their state Medicaid office to determine eligibility for the various federal and state programs. Those who do not qualify for LIS with limited resources may be eligible for assistance with their Part D drug costs through a state's pharmaceutical assistant program. And guys, don't worry, I'm going to throw you a verbal pop quiz after I get done sharing my screen with the most important things that you need to know. Part A, benefits and original Medicare cost sharing. This is important to know as well. Inpatient hospital care, including care provided by acute care hospitals, critical access hospitals, inpatient rehab, and long-term care hospitals. Those are all Part A. Up to 100 days of home health care after leaving the hospital or skilled nursing facility. Part B covers home health care without a prior hospitalization or skilled nursing facility if certain conditions are met. So when they're talking about Part B covering home health without a lengthy hospital stay, that's going to be more in tune with your knee replacements, things like that, so that PT can come to the house. Not so much just them coming, because you stayed in the hospital overnight. If you stay more than 3 nights, then you have the home health, generally at no cost. Number 3 is blood, skilled nursing facilities and rehab care up to 100 days after a 3-day hospital stay. MA waives the 3-day stay requirement. With MA, for those who are new, because we do have new people on here, are Medicare Advantage plans. Inpatient psychiatric care up to 190 lifetime 9 days. That includes if they need rehab because they have abused drugs. That is on the test. You need to know inpatient psychiatric or rehab for drug use, you have 190 lifetime days in hospice. And that's under the Part A. In 2024, beneficiaries pay the following under original Medicare. A $1,632 deductible for each benefit period starts the day they are admitted to the hospital or skilled nursing facility and ends after the beneficiary has not received care for 60 days in a row. So I underline benefit period because even a lot of agents don't understand that deductible on Part A, you not only pay it when you go to the hospital the first time, but that ends after 60 days, and then the beneficiary is responsible for that deductible again after 60 days. So days 1 through 60, $0 coinsurance for each benefit period. Days 61 through 90, they will pay $408 per day each benefit period. So let me clear that up a little bit for the newer people on here. A benefit period is 60 days. If they're in the hospital for those 60 days, 6 days 61 through 90 go to $408 per day. If you have something else that goes wrong with you after that 60 days, let's say that you were in, and anybody can jump in and bail me out of this, but if you were in the hospital and you're at home recovering and you are on your Dilaudid or morphine at home and you fall and break a leg and it's after the 60 days or during, it's a whole new benefit period. Does that make sense? Somebody coughed off mute. Okay. Nobody said anything. Days 91 and beyond are $800 coinsurance per each lifetime reserve day after day 90 for each benefit period. Again, benefit periods 60 days. Just remember that. Lifetime reserve days. Days the beneficiary can use after being inpatient for 90 days. They have a total of 60 reserve days per lifetime beyond reserve lifetime days, all costs. The only thing you need to know for the test, swear to you, is the psychiatric question I gave you for abusing drugs. But you still need to know this to help people. 24 beneficiaries pay the following under Original Medicare: $0 days 1 through 20, 204 days 21 through 100, and 101 days 1 and 1 beyond, all costs. That's if they only have Original Medicare. Part B generally covers physicians and other healthcare professional services, outpatient hospital services, clinical lab and diagnostics such as X-ray, MRIs, CTs, medical equipment, home health, physical and occupational therapy, ambulatory surgical centers, and chemotherapy outpatient. I have a pop quiz question for everybody on here. So, how much, if I'm on a Medicare Advantage plan, how much am I paying for DME and chemotherapy? Generally speaking. 20%. For DME, durable medical equipment, and chemotherapy, or a lot of the Part B infused drugs, if you have Medicare Advantage, it generally doesn't have an all-inclusive copay. It would be 20% coinsurance. Other parts of Medicare Part B, if you are just, again, have Part B and Part A through Original Medicare, ambulance services, chiropractic, opioid use disorder treatment, not inpatient, e-visits, diabetic supplies, CPAP machines. Diabetic supplies and CPAP machines will also fall under that 20% coinsurance. Vaccines, mammograms, and smoking counseling, those are generally $0. Dialysis should have a copay. Outpatient mental health, certain telehealth services, transplant, physician services, and drugs. So if you only have Medicare Part B, after you pay your annual deductible. All of those, if you do not have a Medicare Advantage plan or a Medicare supplement, you'll be paying 20% of this until it ends. There is not a stop loss. Medicare Part B, Original Medicare cost sharing. In 2024, Medicare beneficiaries pay the following amounts for Part B services under Original Medicare. $240 annual deductible does not apply to certain preventative services. So what that means is if you need a mammogram, you are not going to have to pay the $240 deductible. That's preventative, and that would come up at $0. But everything else after deductible to 20% cost share of Medicare approved costs for Part B covered services. Beneficiaries covered under Original Medicare and MA plans will have no cost sharing for most preventative services. It repeats a lot. Not covered by Medicare Parts A and B. Routine dental indentures, cosmetic surgery, custodial long-term care, health care outside the U.S., concierge care, outpatient prescription drugs, massage therapy, routine eye care and glasses, and hearing aids. So again, that was original. Those are things that are not covered under Original Medicare, but potentially could be through a Medicare Advantage plan or some Medicare supplements. Those receiving Part A and or B services through Original Medicare have the right to appeal as well as Medicare coverage and payments. Beneficiaries must file an appeal with, this is in the test, 120 days of date they receive their Medicare summary notice known as MSN. MSN shows Part A and Part B services and supplies providers and suppliers bill to Medicare on their behalf. MSN also shows what Medicare paid and what the beneficiary owes. The MSN also shows what may be fully or partially denied. So the MSN through the Part A and B Original Medicare is going to be like an EOB that we're all used to, accustomed seeing in our own insurance that we use. This is what they should have paid, this is what they paid, and this is what you owe. That's basically what MSN is. Claims can be tracked down electronically on mymedicare.gov. Beneficiaries must file a Part A and B appeal within 120 days of date that they get the MSN in the mail. That's super important to know. 120 days of the date they receive it in the mail. Appeals are sent to the Medicare Administrative Contractor, MAC, that process their claim. Instructions are found at medicare.gov. If beneficiary does not agree with the MAC's decision, they have 180 days after receiving the decision, that is also on the test, to request reconsideration by a qualified independent contractor, known as QIC. Again, I will send you all this. There are additional levels of appeal depending on the level of controversy. Fast appeals for certain services. Beneficiaries on A and B can use a Medicare fast appeal if they feel services are ending soon. We only have 9 more slides and I've lost track of time. Okay, good. We still have time. Medicare on A and B can use a Medicare fast appeal if they feel services are ending too soon. This includes services provided by a hospital, so if they feel like they're getting kicked out too soon, or skilled nursing facility, home health, rehab, or hospice. They have the right to appeal that. Their provider will give them written notice before the ending of services. This includes how to file an appeal. But we all know if it's Medicare Advantage, they're going to be calling us. Somebody's going to call us to go to the carrier. Grievances, Original Medicare. Beneficiaries can file grievances about their providers or quality of care instructions, medicare.gov. 24-hour helpline is at 1-800-MEDICARE, can be used for asking about a claim, coverage, and health and benefits, premium payments, or other questions about Medicare. Beneficiaries may also get help through SHIP, and they can go to SHIP Center. SHIP, what does that say? ShipTACenter.org. I need glasses. Original Medicare and Part D. Beneficiaries of Original Medicare can get a standalone prescription drug plan. That question is on there. Generally, except for dual eligible, must select a Part D plan. Beneficiaries who roll in a Part D plan typically pay a premium, annual deductible, and a per prescription cost share. When choosing a plan, beneficiaries should consider premiums and cost-sharing formulary and network pharmacies. Medigap supplemental insurance works only with Original Medicare sold by private insurance companies and fill in the gaps. That's exactly how they word the question. Fill in the gaps. Just know that that's a Medigap or Medicare supplement insurance policy that you can buy through private insurance companies. That was a lot. Coordinates with Original Medicare. Some Medigap policies cover limited benefits not covered by Parts A and B, such as extra days inpatient, foreign travel, etc. Medigap is not Original Medicare or Part C. That is on the test. Cannot be combined with a MA plan and is illegal to sell to someone who is already on a MA health plan. So, yeah, we'll get more into that.
Hey, Taryn, is Medigap considered MedSup? Is that the same thing?
Yes, a Medigap is a supplemental insurance policy.
Okay, perfect.
Medigap is available in standardized benefit plans A through N. Different plans available in Massachusetts, Minnesota, and Wisconsin. Turning 65 and signing up for Part B triggers a 6-month Medigap open enrollment. Medigap insurers must issue a policy regardless of pre-existing conditions. This is called guaranteed issue right. And I want to word that correctly, that is only within the 6-month open enrollment window when they first become eligible. There are different rules for different states. I believe Charlie was doing a training on this. Kind of got caught in that, but states regulate Medicare supplements, and there are a lot of different rules in different states. In Oklahoma, we have the birthday rule where they can switch from one Medicare supplement to another with guaranteed issue. But to sign up for a Medicare supplement, all 50 states, I can say with certainty, with guaranteed issue right, within the first 6 months of eligibility. Insurance and sales of Medigap plans are regulated by the state, which has varying laws. Leaving a Medicare Advantage plan may trigger a guaranteed issue right. You have to look that up specific to your state. So there's not a way for me to exactly train on that. But for AHIP, it's not going to ask about your specific state, but I will tell everybody that a lot, especially if you're one of those that's in my provider channel, a lot of the health people, the hospitals, they are wanting people on Medigap. I'm not saying that's what you should do, but I would be up to date with the laws on that just because of that. All Medigap plans pay for some or all of the following. Part A, coinsurance. 365 additional days. Hospitalization. Guys, I am so sorry. I have had the hiccups all day, and I'm trying to not hiccup out loud where y'all can hear it, but it's just cutting me off as I'm speaking, and so I'm just going to call it out. I have the hiccups.
I didn't even notice.
Okay, good. Part B, coinsurance. The first 3 pints of blood, hospice, coinsurance, or co-payment. Medigap without drug coverage. Medigap HI and J offer non-Medicare drug coverage. They will no longer to be sold after January 1st, 2006, and this is why I left it in here, but some beneficiaries are grandfathered in. So there are plans out there that people are grandfathered in that is a Medigap that has drug coverage included in it, HI and J. And if a beneficiary is enrolled in HI or J, they may not have credible coverage and would have a late enrollment penalty. So that was very interesting to me as well. That one sentence. It's not even the test that I can see so far that I've taken, but that was just very interesting to me. Beneficiaries with HI or J may keep their Medigap plan, drop the plan's Part D coverage, and enroll in a standalone PDP. Those enrolled in Medigap must also enroll in a PDP, or they'll be exposed to a late enrollment penalty. Non-Medicare insurers, including Medigap, are required to notify beneficiaries annually as to if they have credible coverage or not. Credible coverage is equal to or better than Medicare standard. That is exactly how it is worded on the test. Those who do not maintain credible coverage must pay a late enrollment penalty if they enroll in Part D unless they qualify for extra help. Those who lose credible coverage will have a SEP and not have a LEP. So what that's referring to, and I'm sure it's in the next stage or whatever, is that if they have a plan through their employer and it's been credible up to this point, and then they get a letter that our plan is no longer credible, which I think there may be a lot of that this year, and I'll get into why in a minute. But I think you'll see a lot of people who are enrolled in their employer plan that is not going to be credible next year.
So Taryn,
They
if they
don't have an
qualify,
SCP. Do what?
so if someone qualifies for extra help, they don't have to pay that late enrollment penalty, so long
Nope.
as it's okay. All right.
Yep. That gets
10%?
rid of that LEP.
Okay.
Changes to the Medigap after 12/31/2019. I left this in. Newly eligible may not be able to purchase Medigap that pays for Part B deductible. Those already enrolled may remain. Those eligible before 2020 may enroll in plans covering Part B deductible. So, to our attention, because we all go throughout our day, but have you ever thought about the people who have Part A and B that are inquiring about Medigap that were eligible before 2020 and how that may affect them if it's 2024? Because they do have these opportunities because they were eligible before 2020. So, Medigap rules for individuals who became eligible for Medicare after December 31st, 2019. Individuals who attained age 65 on or after January 1st, 2020, or Medicare due to age, disability, or end-stage renal disease on or after January 1st, 2020, may not purchase a Medigap plan that pays Part B deductible. Generally, Plan CF or High Deductible F, but the prohibition also applies in waiver states with non-standard packages. So individuals previously enrolled in plans that cover Part B deductible may remain enrolled in those plans. Individuals who became eligible for Medicare before 2020 may enroll in the plans that cover the Part B deductible. So, if you talk to a beneficiary who was eligible before 2020, they can still get those plans if your state allows it. And in here, I just threw the different plans in here because as we navigate through all these changes, and in a minute, I'm going to quit sharing my screen. I'm going to give you a pop quiz and explain why this is so important. But this is how the different parts of the Medigap system work. So I just thought I would throw that up there for everybody to look at. I'm happy, again, to send this to you to your email so that you have it. Hey, guys. I think that was the last one. Yep, it was. So now that I quit sharing, let's get this PowerPoint off. I have a pop quiz for you. Okay. Did I lose y'all?
Nope, I'm here.
Okay, good. That's good. You disappeared from me. Okay.
Hey, Taryn.
Yeah.
I was trying to send a chat that I wanted the slide deck, and it will not let me type in the chat for whatever reason.
Oh, really?
Yeah, I've clicked everything I'm seeing, but it won't let me type. So I do want that slide deck, though. This is Tamara.
Okay. Let me see here why it won't let you chat.
It says chat is only available during the meeting, but it's during the meeting,
there.
so I don't know the problem.
I'm going to put my information here so that you can email me for those who can't do it.
Okay.
That way I don't lose sight of something because I'm pulled a million directions over here at Medicare Compare. Okay. All right, guys, pop quiz time. So let's see how I can do this. I have it over here. So Miss Park is an elderly retiree. She has fixed income. What could you tell Ms. Park that might be of assistance? So here's our choices. She should only seek help from private organizations to cover her Medicare costs. She should not sign up for a Medicare Advantage plan. She can only apply to the Medicare agency for lower premiums and cost sharing. Or she should contact her state Medicaid agency to see if she qualifies for one of the several programs.
D.
Correct.
So that one, yeah.
I got to figure out a different way to do this. That's a lot when it's multiple question. Let me think this next one through. Okay, true or false? Medicare Part B, original Medicare cost sharing for skilled nursing and rehabilitative care is under Part B for skilled nursing and rehab. True or false? Part A, I said Part B.
False.
False.
Part A. Ms. Quinn recently turned 66 and decided after many years of work to retire and begin receiving Social Security benefits. Shortly thereafter, Ms. Quinn received a letter informing her that she had been automatically enrolled in Medicare Part B. She wants to understand what this means. What could you tell her? Would you tell her she will need to pay no premiums for Part B?
No.
Due to the number of quarters? Very good. Nope, that's not the correct answer. Part B will cover her routine dental and vision needs.
No.
Nope.
Part B primarily covers physician services. She'll be paying a monthly premium and expect for many preventative and screening tests. Generally will have a 20% copayment for these services in addition to an annual deductible. True or false?
True.
That is true. Medicare Part B primarily covers physician services. Enrollees pay a monthly premium based on their income level and have a 20% coinsurance except for preventative benefits.
True.
And a lot of times people ask me whenever I'm talking to them, why do I need anything outside of original Medicare? I just want to reiterate, even if we're talking about original Medicare fee-for-service, there is no stop loss. That 20% of a lot is still a lot. They still need your help to get a Medicare supplement if they can't afford that, a Medicare Advantage plan, and always remember the Part D drugs. Okay, let's see what else we have here.
Stop loss is the same as maximum out of pocket, basically.
Yeah, because stop loss meaning they have 20% of an infinite amount. When you have a Medicare Advantage plan, you have that MOOP, you have that maximum out-of-pocket protection. You don't in original Medicare.
Okay.
And I'm going really in-depth, guys, because I know I have new people on here who have sold Medicare. So, veterans, stick with me. And let's see how we can ask this question. Are individuals with coverage through their current employer, are they exposed to a late enrollment penalty if they decided to stay on their plan?
No.
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 Correct.
John, you turned sideways.
Oh, sorry. I know that. My hand was getting tired holding my phone. I'm so lazy.
True or false? True or false? Medicare will cover a total of 190 days of inpatient psychiatric care during a lifetime.
True.
A beneficiary's lifetime. True. True or false? Medicare Part B covers massage therapy, dentures, or routine eye examinations.
False.
False.
Very right. Very right. Okay. True or false? Part A provides coverage for hospice stays.
True.
True. This one I'm just going to tell you. There's no way to ask it. There's not a good way to ask it at all. It says, what, if any, what impact, if any, have recent regulatory changes had on Medigap plans? And here is the correct answer. Starting January 1st, 2020, Medigap plans sold to individuals who are newly eligible for Medicare are no longer allowed to cover the Part B deductible. If an individual already had one of the plans before January 1st, 2020, they can keep their plan. If an individual was eligible for Medicare before January 1st, 2020, but not yet enrolled, he or she may be able to purchase one of those plans. So what they're saying in short is, if somebody was eligible for Medicare but didn't, continued working, whatever, and didn't enroll into a Medigap plan that covers that Part B deductible, they may, depending on the state, be able to enroll into a Medicare supplement that does cover that Part B annual premium, which is $250. So I would look at premium if I was deciding that for someone. So true or false? This is the next question. True or false? Individuals who attain age 65 on or after January 1st, 2020 cannot purchase a Medigap plan that pays for Part B deductible.
True.
Very good. Okay, true or false? Costs for Part D as in dog. Beneficiaries typically include a monthly premium, annual deductible, and per prescription cost sharing.
True.
True. So I want to let y'all know, I want to tell y'all what's going on. I'm sure you've been hearing about it a lot, and we'll go way deeper into this as the week progresses. But is everybody aware of the Inflation Reduction Act and how it's going to impact us?
I've heard about it, but don't really understand it.
Okay, good. So I'm going to give a very high-level overview of it, and we will dive into it as we dig in deeper. But I want to make sure we have enough time for this, and we're running out of minutes. So the Inflation Reduction Act that is going into place is going to lower the cost of the max out-of-pocket for prescription drugs to $2,000. So that sounds good on one side of the coin because we get excited for the beneficiaries that the most they're going to be exposed to is $2,000 throughout the whole year on their drugs. They also set up a mechanism through the carrier in the pharmacies that they can do payment plans. And that means that the pharmacy, or it's really through the plan, they can divide up the cost of their drugs and divide it by 12 and have a monthly payment that the beneficiary will pay. We will dive into that really deep into it probably Wednesday. Wednesday is a big day. It's all about the Part D and the Inflation Reduction Act. But what happens is if they don't make payments on that average monthly payment, then they will owe the full amount that they would under the insurance at the point of sale at the retail pharmacy. So how is this $2,000 max going to impact plans?
So you have fun.
We are going to see increase in premiums, even more non-commissionable Part D drug plans. So this is going to have an impact not just on the beneficiaries to where they're only exposed to $2,000, but it's going to affect everywhere. We are right now seeing Medicare Advantage plans pulling out of markets because Medicare Advantage plans also include Part D prescription drug plans. So it is impacting our whole universe. How it's all going to shake down, we're not going to know until probably about September, but we're going to learn about this all the way through every module in AHIP. And you're really going to see a big difference in the plans as they come to give us our, sneak peeks in September. But a lot of carriers are showing you a little bit, but they're not going to, because a lot of them went back to CMS. CMS said you must make these changes. And now there's a little tug of war going in, but they had to have their final in on July 3rd to answer to any requests that CMS made to them after they turned in their plans. So that's a little current affairs of what's going on in our universe. And it doesn't matter what state you live in. It doesn't matter any of that. That's just our whole universe. Any questions? Because I've talked a lot.
I have a question, Taryn.
Yeah.
Would you kind of explain LIS versus extra help?
It's the same thing.
Are they?
Pretty much, yeah.
Do they
low income subsidy and extra help, you have to qualify for it based on income and what percentage below the poverty level you are. LIS has, or extra help has 4 or 5 levels? 25, I think it's 4. And whenever you qualify for LIS, low income subsidy, extra help, it also decreases your Part B premium as well as your prescription drugs.
So does an applicant go through the same source to see if they qualify?
Through Social Security, yes.
For both LIS and, okay.
Yes.
All right, thank you.
Yes, and they go through their state for Medicaid.
Okay. Thanks.
According to AHIP. You can apply for all of it at once if you want to online. Your beneficiary can, or you can for them. Any other questions?
No coverage for uncontrollable hiccups? Nothing like that?
I'm sorry?
No coverage for hiccups?
No. That is the 3rd time today I've had hiccups, and I have no idea why. I haven't been drinking, guys. I've been drinking Pepsi. And maybe that's why I don't drink soda typically, but I am tired coming back from that long weekend.
Oh yeah, me too.
And I needed caffeine.
Yeah.
Okay, well, we're done with our hour, so those that want to drop off, go ahead. But if anybody wants to stick around and pick my brain, feel more than happy to do that as well.
Thank you so much.
You're welcome.
Thanks, Taryn.
Thanks, Taryn.
You're welcome. See you tomorrow.